Casualty Management. Planning for an emergency. The prevention of accidents is obviously preferable to giving first aid. Nothing can replace adequate supervision of a child in a friendly and relaxed environment. Now and again, however, accidents and illness do happen, and you may be called upon to give first aid to a child in your care. It is important, therefore, to make a plan for how you would deal with such an emergency situation. What would you do if a child in your care has a serious accident or sudden illness? What if that accident or illness happened to you? Take some time to consider what your actions would be if an emergency happened whilst you were caring for children. Useful things to consider when you make your plan. Access to a telephone and a backup if it's out of order. Do you have someone who can care for your children if you have to leave them? Do you have a fully equipped first aid box that is easy for you and others to find? Are the children's record forms to hand so you can take them to hospital with you? Do you have a fire escape plan? What if the exits or stairs were blocked? Do you have an agreed meeting point outside? Do the parents know what to expect if there is an emergency and what you will ask of them? Make a list of important phone numbers that you and others can find easily. Parents of the children, home, work and mobile. Doctor's surgery, yours and the children's. Emergency backup person. Ofsted advisor or childminding network coordinator. Have you been on a first aid course to learn what to do in an emergency? Just watching this video is not enough. Useful information when calling for help. Location of the accident. Which emergency services are required? What happened? Casualties condition, breathing, unconscious, injuries. Number of casualties. The role of the paediatric first aider. First aid is defined as the help given to a sick or injured person until full medical treatment is available. The responsibilities of a first aider include assessing the situation, work out what has happened, count the number of casualties, look for history, signs and symptoms, protecting from danger, assess for further dangers, protect yourself first, then protect others, getting help, ask bystanders for assistance, work out what help is needed, call for help or ask a bystander to call, recognize your own limitations, prioritizing treatment, treat the most urgent thing first, treat the most urgent person first, offer support and comfort, minimizing infection risks, wash hands before and after giving help, wear disposable gloves, wear protective clothing if needed, cover your own cuts with a plaster, dispose of contaminated waste carefully, use sterile, undamaged, in-date dressings. Reporting and recording. Accurately record incidents. Report accidents when necessary. Maintain confidentiality. The aims of first aid: preserve life, prevent the situation worsening, and promote recovery. Consent. It is important to ask for the casualty's consent before giving first aid. Believe it or not, just touching someone without their permission could be classed as assault. If a casualty is unconscious, however, the law allows you to assume that they give consent to your help. If a casualty refuses treatment but you think they need it urgently, call 999 112 for emergency help. Surveying the scene. Let's explore this scenario. There has been a serious accident. What things should you consider before treating anyone? What happened? Working this out could answer some of the following questions. Further danger? Can it happen again? Is there a risk of fire, explosion, collapse, chemicals, traffic, electricity, gas, drowning, etc.? Can you cope? Ask bystanders to help. Use others to make the scene safe, for example, traffic control at road incidents. Avoid individual tasks. Take charge and give jobs to others instead. Number of casualties. This information is vital for emergency services. How many appear seriously injured? Emergency services. What is the exact location? Fire and rescue? Ambulance? Police? Who needs help first? Assess casualties using the primary survey. If there are multiple casualties, tell others what to do.